Thank you for joining us today on APNAO Conversations. I am Pearl Ganta, and we will be continuing our conversation with Mr. IAN FORBER-PRATT. Mr. IAN deeply believes in every child's right to family, and he helps governments, organizations, and individuals be part of a social change in demanding rigorous standards for children needing care and protection throughout the world. Great to continue this conversation with him. Now, so many institutions have sent their children back to their relatives, or maybe a single parent or somebody who's still there. What is their situation? How can we help them?
CCIs, orphanages, institutions, residential facilities, whatever you want to call them, around the world, when COVID-19 hit, a lot of governments required that they reintegrate children back into their communities. But they, instead of reintegrating, because they didn't have time, they reunified. It's a very interesting difference. Reunify means having the kid go back with their family members. Reintegrate means weaving them back into their community. We just picked up kids in a quick amount of time and gave them back to their family members. There's a reason they weren't with their family members. There was some type of problem, poverty, abuse, crisis, whatever. We haven't worked on that normally, but yet the children are back there. So it is a significant concern. However, in the big picture of things and in research, and what you'll hear from children's hearts is they want to be with their community. They want to be with their families when it's safe for them. Now that CCIs, orphanages, whatever, have reunified children with families, it's now time to start reintegrating them. So working with those families and creating case plans of how you're going to address the issues so that child doesn't have to come back to you. And for your organization to begin to think about how you're going to embrace the community and support people. So what the organization should be doing, number one, is every week contacting those caretakers and asking how things are going and checking in on them. Now, maybe some of them are very difficult to find, but do whatever you can to contact them. The second is the organization should be creating a case plan to help that child stay in that family after COVID-19 if it is safe and appropriate. You need to look at educational outcomes. You need to look at their health, their sanitation, their hygiene, everything. Then at the same time, your organization should be thinking about, if you end up having a little bit less children in your home, how do you continue to run your home? How do you continue to get money? And so you do that financial planning, and you also think of community offerings that you can do so that you are ready strategically for when things begin to open up.
How do these families, now the children have come to them, whether they're prepared or not, children are there with them. How do we empower these families to care for these children mentally and physically and emotionally?
When you call one of those families and you talk to them, you should say exactly, Pearl, what you just said. We know that you might not have been ready to have this child back. It's very interesting, actually. When it comes to kinship providers or people who have been given back their children, they haven't been preparing. Adoptive families have been thinking about this for years, and they've been preparing and thinking about it. This family overnight got a child that they didn't expect to have. So number one is owning that and being honest about it. That will make them feel good because they're like, oh, they understand me. And maybe they didn't even think about it that way, but you're giving them the vocabulary to attach to their emotion. Then you work with them with the plan to say, now that, boom, overnight you have gotten a child, now let's start planning about how you transition and cope up. So let me give you a perfect example. So the mother's in the village area. She has one biological son, and now she has gotten her biological daughter. So you call her and you say, we know you weren't ready to have your daughter, but we know you love your daughter. But how are you going to feed her? How are you going to keep her safe? All of those things. So you plan with her. So then you work on a safety plan, and you work on neighbors and all those different things. Or maybe she says, I can't feed this child. And you say, okay, during COVID-19, we know that you can't go out, but is there any way that your village area or your gram panchayat is arranging rations? And you help her figure those things out. You just help her organize and structure the things she is needing to do.
Another thing that concerns me right now is the migrant workers. The stories are, it's so heartbreaking. And my immediate thought is, will they abandon their kids? They don't have jobs, or some of them are dying by the time they reach their home. What's going to happen to their families? What's going to happen to their kids? So, how do we prevent such abandonment? Or does it lead to abandonment?
A high majority of migrants, their last decision is going to be to abandon their children. These are not bad people, and they're not people that are selfish or less than any other human being. But there will be circumstances where they will abandon their children due to intense poverty or dying or things like that. But I believe that's not their intention. However, I do believe that as the dust settles from COVID-19, we're going to see a lot more children in need of care and protection, unfortunately. And we're going to need to find those children. And so what organizations need to be doing is getting ready for that. We don't want bigger orphanages, but we want more homes. We want more families. In this COVID-19 time, people are realizing more and more the importance of family. They're spending more time with their family. They're getting rid of some of those distractions. And so what we need to do is talk to more families about bringing children in a safe and appropriate way and get messaging out to more and more people so they can understand what their options are. Adoption, foster care, supporting other organizations, those things. We need to come together as a community.
Some of the social messages we put out was like, if you're an organization, maybe you could create job opportunities. Or if you have any entrepreneurial skills, maybe you could empower somebody, do some skill building things. What else? How can we do to help facilitate income generation to families?
Well, true. And the issue is that we need to do things that are very low cost because not a lot of money is going around normally in the NGO world, but especially now. Donations are getting less and all those things. So the thing to do if you're an organization is to figure out how you can create vocational opportunities, training courses, all of those different things for people to access. Now, as you know, we have some issues or many issues with access to technology, web, computer, all that stuff. But as things open up and when we do have a vaccine or we do have a treatment, being ready to offer to the community the things that they need. Many times NGOs offer the things that the community doesn't need. Mm-hmm. The other thing is that's very important is making sure that you are giving empowerment and education skills, not only vocational training, but bringing people together to learn how to ask why.
Thank you so much, Mr. Ian, for joining us today and encouraging us, challenging us, and you continue to inspire me again. So thank you so much. Thank you. Children have a right to family, right to safety, hygiene, and right to education. These are some of the basic things that have or will become a distant reality for some children. Now, we as individuals, as families, as a community, and organizations can come together and do our part to prevent abandonment of children. Would you be willing to do your part? Do subscribe to our YouTube channel and like our Facebook page and continue to converse with us. Until next time, this is Ganta from APNAO, Nai Sonj, Naya Jeevan.